Hi there, my name's Shantel. I'm one of the clinical trainers at Harley Academy. Thank you so much for sending in your questions regarding being a prescriber, not being a prescriber, and let's see if I can help. So the first question is, did I go through my NHS job or apply privately via a university? I no longer work under the NHS, although I do still maintain a bank contract. So I did go privately via a university and I did my V300 prescribing course at the University of Essex. You just apply as you would normally for any other university course, putting in your credentials, qualifications, etc. So there has been a few questions about how hard is it to get onto a prescribing course and will universities take newly qualified nurses. So the rules of applying for your V300 are that you are 3 years post-qualification and at least 1 year within the field that you wish to prescribe within. So if you're wishing to prescribe within aesthetics, you need to be practicing within aesthetics for at least a year prior to being able to start your V300 course. There's also been a couple of questions regarding, did I find the course super hard? Was it really challenging? Just like any qualification, it is quite hard. It can be done at level 6 or level 7. It's completely up to you and it doesn't really change your end outcome. Level 7 is recommended for if you're considering to go ahead and do a whole holistic master's qualification. So it is challenging, but equally completely achievable and doable if you're someone who's already obtained a degree. It's at a very similar level to that. What I did find quite hard was how time consuming it was, and fitting that around my normal general role and professional job is quite challenging. So make sure that you're choosing to do your course at a time that's suitable for you with everything else that's going on in life. So a couple of you have mentioned that you're going to be joining our foundation course really soon, which is super exciting, and asked if you'll be receiving more advice about it then, which yes, you most certainly will, and particularly if I'm on your day, you can ask any questions regarding prescribing. Some typical questions I am asked is that how can you be successful without being a prescriber within aesthetics? I was a non-prescriber for the first 3 years of practicing within aesthetics. I was just very fortunate to have an amazing mentor. So my recommendations for you are reach out to people who are local to you or colleagues, other prescribers that may be willing to prescribe for you and equally mentor you through those early stages of your aesthetics career. It needs to be someone that you have a very great rapport with because it's a very trusting relationship, and equally it needs to be someone who completely has the same morals and ethics as you do also. Another question has been whether you can do your prescribing course after your level 7, and simply yes you can. I completed my level 7 first and then went on to do my prescribing. Another question also was that after achieving your level 7, are you then guaranteed a position on a prescribing course? The answer to that is unfortunately no. They're two separate qualifications and the entry requirements don't sort of match. So yes, so doing your level 7 is fantastic, but it doesn't necessarily guarantee you a position on a prescribing course. Price-wise, for a V300 course, you are looking anywhere between 2,000 to 4,000. Typically, when you're in aesthetics, also you need to also pay a DMP, so your mentor, and whatever fee they charge you is entirely up to them. Some places, particularly around London, offer a specific DMP mentoring program. But yeah, so expect to pay for the university fee, but equally a fee for your mentor. So great ways to obtain a prescriber. So Aesthetics Associates is an option. You can also go via the back-end, so the British Association of Cosmetic Nurses. You can also network via COMA, which hopefully a lot of you have joined now. So the COMA community is a great space to ask if anyone's in your area to be your prescriber. Networking is also a great opportunity. And finally, just from my own experience, if you are a prescriber already and considering prescribing for someone else, how it used to work with myself and my prescriber was I would facilitate consultation clinics, so block out an evening or a day or a weekend, and I would just have back-to-back consultations with my patients, with my prescriber present, and then she would write up the scripts for me there and then onto my pharmacy account. You then pay a fee per script that you give to your prescriber. What fee your prescriber charges is completely to their own discretion, but it's quite a fluid process. The backend give amazing advice on prescribing, and they do recommend face-to-face consultations always for any new patients, and equally for each time that you require a script.